Biliary cirrhosis. This is our topic. Primary biliary cirrhosis, also known as primary biliary cholangitis. Okay, so primary biliary cirrhosis, also known as primary biliary cholangitis, and it is a autoimmune disease. It is a autoimmune disease, and this autoimmune is T cell mediated. T cell mediated. T cell mediated, and females are more involved. Females are more involved. Okay, involved, more involved, like 9:1. Male is to female is to male is equal to female is to male 9:1, and 30 to 50 years 30 to 50 years ages patients are more involved. Females are more involved, and this this is associated with this disease it is important, associated with Sjogren's syndrome. Associated with Sjogren's syndrome. So primary biliary cirrhosis is also known as primary biliary cholangitis. It is an autoimmune disease, T cell mediated. Females are more involved, and 30 to 50 years of age as this females are involved, associated with Sjogren's syndrome. So this is pathogenesis is, so this autoimmunity is autoimmune mediated disease, and mostly the biliary duct are involved. Biliary ducts are involved. Biliary ducts are involved, so bile cannot drain in the from liver to the gallbladder, so bile cannot drained, proper amount bile cannot drained from liver. Okay, from liver, that's why cholestasis happen. Cholestasis happen, and result is inflammation in liver. And it's going going to cirrhosis of liver. So this is a pathogenesis. Then clinical features. So pathogenesis is biliary ducts are involved by T cell, and that's why there is a problem in bile pathway. So the bile is formed in the liver, and the formed amount of liver cannot drain to the liver. That's why cholestasis occur in the liver, and inflammation of liver, and cirrhosis occur. Okay, as a result, cirrhosis occur. Then clinical features. Most of the patients are asymptomatic. Then fatigue, jaundice, then pain abdomen, and liver palpable, then diarrhea, steatorrhea, steatorrhea, diarrhea, steatorrhea. This is and pruritus. Pruritus. So these are the clinical features seen in the primary biliary cirrhosis or primary biliary cirrhosis or primary biliary cholangitis patient. Then investigation. Investigation in routine investigation. LFT. In LFT, ALP level is much increased. Also ALP, then GGT also increased. Then here is a special antibody seen, and that is antimicrobial antibody. Seen, antimicrobial mitochondrial antimitochondrial antibody. Antimitochondrial antibody seen. And last treatment. Treatment is to prevent cirrhosis. To prevent cirrhosis, we can give this patient ursodeoxycholic acid or UDCA tablet. Okay, and also can give vitamins, multivitamins. Then we can give cholestyramine. So these are the treatment, and this is all about the primary biliary cirrhosis. So primary biliary cirrhosis clinical features. Most of the patients, 60% about patients, are asymptomatic. Then fatigue, jaundice, pain abdomen, diarrhea, steatorrhea, and pruritus. Investigations are LFT. In LFT, ALP level is much increased, and GGT and antimicrobial antibody is positive. Treatment is to prevent cirrhosis. Ursodeoxy tablet, ursodeoxycholic acid, and multivitamins can be given. And if pruritus and other features are seen, then cholestyramine given.